It's clear that today's healthcare systems are under increasing pressure, with record numbers of us living longer and more of us experiencing chronic conditions. We're putting huge demand on already straining services. Not only is this driving up healthcare costs for everyone, from you and I, through to doctors, hospitals, employers, governments, and medical insurance providers, but our current healthcare model of just treating people when they're sick is simply not sustainable.
The traditional healthcare today is really focused on sick care. It's focused on addressing problems as they occur. And unfortunately, it's also a very fractured environment.
The reality is, healthcare only contributes 10% to our long-term health, whilst our society and environment and our individual behaviours have a much greater influence. There's a pressing need to move away from our current model of sick care towards a connected healthcare model that is proactive and personalised to each of us, our needs, our circumstances, our aspirations, our stories.
When you have a connected care system, what you're doing is you are connecting those dots and you're identifying the potential for future problematic events earlier. Everyone is connected together and working towards the best outcomes of the patient. The provider, the doctor, has all the information that they need to provide the best evidence-based care, that you're also connecting in those social services that may be needed. It's a much more efficient system because it's focused on the health outcomes versus focusing on the sick care.
A connected care model brings together information from many aspects of our lives, from our lifestyle choices, financial situation, and home life, to our environment, health knowledge, and personal health goals. This rich picture of our lives means healthcare professionals can not only help prevent us getting sick, but ensure the best possible treatment and health outcomes if we do fall ill.
Aetna today provides a lot of care services that many people may not be aware of. We have a lot of wraparound services that really help the members achieve their best health. One of the biggest innovations that's happening out in the healthcare space is moving much more of the care to in-home care.
Technology has always played a key role in healthcare, and with connected care, it can have a huge impact in supporting our needs at every stage of our healthcare journey. Aetna's vHealth service, where patients can talk to a doctor virtually, has reduced the need for in-person consultations by 47%. And where patients opted into Aetna's text message reminders, flu incidents were reduced by 34%. Aetna's Quit Smoking Wellness Programme also showed great success in the UAE, with 71% of participants giving up the habit within 6 weeks. These types of early engagement not only helps us stay well, but keeps our claims, costs, and premiums in check.
We like to engage with our members the way that people communicate in everyday life. We conduct webinars on stress management or dealing with high cholesterol. We provide employee assistance services. So if you have a situation at work that may be stressful, you want to talk to somebody, we have counseling services at the ready.
Aetna can also identify members at risk of developing a disease or where their health is at risk of deteriorating further. Last year, where these members engaged with Aetna's one nurse to one member outreach model, hospital admissions were reduced by 60%.
I think what really makes a difference is the whole caring part. We really care about our members. We care about what's going on in their lives. And it's not about what's the matter with you. It's what matters for you.
Aetna's international long-term vision is to build a culture of health and well-being within its communities that not only transforms how people access and experience healthcare, but reduces the pressure on healthcare systems, improving the quality of life for millions of us.
To learn more about Aetna's international approach to connected care, search online for Aetna's Connected Care.